So anything that we can do as a state agency to help the state save money is good for all of us. So without further ado, I'm going to introduce you to Dr. Tornelli-Mitchell.
Can y'all hear me okay back there? Well, first of all, I have to say I'm so excited to be here in person. And I mean, isn't this great? I mean, this is like one of our first events out here with real people and not in cameras. But no, I just want to thank y'all for coming today. It's a huge honor for me to be able to be here today and just kind of chit-chat a little bit with you and tell you about some of the things that we're doing at Tech. Because some of the things that we are doing to lower our healthcare costs and improve the health and wellness of our employees are things that really take home lessons that all of us here in this room can really think about and apply. So what I thought I would do this morning is just give you a little bit of information about my background, and then I'm just going to jump right into the meat of things and talk to you about really what I consider to be some of the most significant health problems that our state, that our nation faces today. And then I'm going to show you why that has to do with what we were doing at Texas Tech. And hopefully conclude with what I call a little prescription. When I was at the Cooper Clinic, patients would always come up to me and say, okay, tell me a secret. What's the diet that I really need to be into? What exercise regimen do I need to do to lose weight and be healthy? And the fact of the matter is there's no secret, there's no mystery. Every time I hear about this new fad diet or this new diet pill that comes out, I go, well, if it really worked, we'd all be using it and doctors would be real happy. That's not the case. So what I'm going to do is try to give you a little prescription for what I consider what to do to have a great life, which is the same type of prescription that we're trying to apply with all of our employees and staff at the Texas Tech University system. Then I'm going to conclude by introducing a friend of mine, Lacey Wolf, that I have come to meet since we failed our health report card at Texas Tech. And we've become friends and love to chat because we're both very passionate about health and nutrition. So I'm going to introduce Lacey to y'all in a little bit. And she's actually going to give you all some more focused information about, as a group, as a state agency, what your own health benefits are. And we'll talk then a little bit about some of the gift bags that we have for you. And I want to tell you a little bit about some of the things that we have in there for you. And hopefully will help you to implement some of the things that we're going to talk about today. All right, well, let's go ahead and get started. So, as my husband said, we both practiced at the Cooper Clinic. Now, how many people here are familiar with the Cooper Clinic in Dallas? Oh, good. I hope that a lot of y'all have been there as patients too. But anyway, so the Cooper Clinic is what I call one of the world's premier preventive medicine clinics. And I loved practicing medicine there because I never saw more than 3 to 4 patients a day, which gives us the ability as physicians to spend a huge chunk of time with everybody, getting to know what your risks for different health problems are, getting to know what your dietary habits are, your exercise habits, your social habits. And my favorite part of the day was being able to sit down at the end with every patient, tell them the results of all of their testing, stress testing, fitness testing, body fat testing, blood work, and come up with a plan that was going to help them have a good life and change some of their health risks. So I'm basically giving you today the same kind of a prescription that I used to give my patients. The Cooper Clinic was founded by Dr. Ken Cooper. I don't know if any of y'all know him. He's also known as the father of aerobics. In fact, you can actually Google father of aerobics and Ken Cooper's name comes up. He's a wonderful mentor to both myself and my husband. And two of the big things that he is known for is, number one, for talking about what the benefits of cardiovascular fitness are for long-term health and wellness. Cardiovascular fitness, that's such a big kind of scientific kind of word. And he took that, and he is the man known for coining the term aerobics, or aerobic exercise. And in 1970, he published his book, Aerobics. I don't know if any of y'all have read it, but it's been translated in 41 languages, including Braille. But it basically talks about the benefits of exercise for long-term health. Now, right now in 2021, that just sounds like such an obvious statement. Yeah, we all know exercise is good for you. But back in 1970, they really weren't sure about that. Back in 1970, Ken Cooper was telling people who had heart attacks that they needed to go exercise. Ace, he almost got kicked off, he almost lost his medical license because he was telling people to do something that in that day and age was heresy. If you had a heart attack, you were subject to a life where you would stay at home, you would rest, you know, it was basically almost the end. And so he's really a pioneer in discovering that one of the best things that we can do for our cardiac health, long-term health, is to exercise. The second thing that he's really known for is for preventive medicine. Because back then, too, physicians really spent most of their day talking to people about how to treat their illnesses, how to treat their diseases, their conditions. Very little time was actually spent talking to people on how to prevent them from starting altogether. So being at the Cooper Clinic for me was really, really a highlight. And I've always had an interest in exercise and health and wellness. And so for me to be at the Cooper Clinic practicing preventive medicine has always been a great thing. So that's a little bit about me. All right, so let's kind of jump into things. And what I'd like to do is talk about 1900. I always think history, it's a good thing to go back in history, and whether it's fortunate or not, history tends to repeat itself, and I think we can learn a lot from history. So I thought we'd start out by looking at the leading causes of death in the 1900s. Now, the big take-home message that I want you to get from this slide is look at the top 3 causes of death in the 1900s. Flu, pneumonia, tuberculosis, and infectious diarrhea. You know, like you go to Mexico and, you know, get Moctezuma's revenge. So the 3 most common causes of death at that time were infections. Now, on that list, further down, you have heart disease, strokes, cancer. Back in those days, we didn't know about Alzheimer's disease. They called it senility or senile dementia. But those were some of the other minor causes of death, but infection was really the number 1 cause. And if you look at this graph, and it plots the years, 1900 through 2000, and the death rate, this has to do with infections. And if you look at this peak over here, you'll see right here around 1918, that was the global flu pandemic. And it took almost 3 decades later before we had a flu vaccine. But after that, what you see is that the curve is slowly going down, meaning infection as the top cause of death started to go down probably around the 1920s. And if you ask yourself, okay, well what was the cause of that decrease? Well, we had better sanitation. In 1928, Alexander Fleming found penicillin. Now, even though penicillin was fortuitously discovered in 1928, it wasn't until about 1940 that we actually started using penicillin. And it was actually the military who started using penicillin more on a wide-scale basis, and they would use it to treat wounds in soldiers. So as our mortality from infection diseases has dropped, it's due to sanitation, better sanitation, antibiotics, and vaccines. In the 1940s, 45 with the flu shot, then we had diphtheria, we had polio. So vaccinations, does that ring a bell? Vaccinations have been critical in reducing deaths from infectious diseases. So let's jump a little bit forward, a century forward, to one of the top causes of death in the year 2000. Well, what you see is that we've had a little flip-flop in that little chart. And infection has now fallen down to the list. So number 7 on the list, you have flu, you have pneumonia. Number 10 is septicemia. I don't know if y'all have heard of that term. It's kind of a medical term, but you may have heard the term blood poisoning. That sometimes when people will get an infection, it's so bad it gets in their blood and it travels to all the other organs. So infection is still a common cause of death and one of the top 10 causes, but it's down on the list. So what's up on the list? It has to do with modern day society, with urbanization. It has to do with the fact that we're more sedentary. We are not active. So now we have heart disease and cancer as the leading causes of death in the year 2000. So we're going to fast forward it a couple more decades. And if you compare the leading causes of death in 2000 to 2019, so what's the take-home message here? The message is that the leading causes of death in the last couple of decades have not really changed that much. We just moved some up the list, down the list, and if you actually look at all those years, some go up, some go down, but it's basically the same causes, except the two things that never have changed as of yet is that number one killer of people in this country, both men and women, is heart disease. And the number two killer of people in this country is cancer. Now, if you're curious, let me just kind of throw this here just to tell you a little bit about cancer. What do you think is the number one cause? Which cancer do you think is the number one cause of deaths in this country? Which cancer? Any guesses? Colon. Colon is good, but it's actually number 3 on the list. Lung cancer. So to this day and age, no matter how advanced we are with technology with things, lung cancer is still the top killer of both men and women. For men, number 2 is prostate. For women, it's breast. Number 3 is colon cancer. And that is totally silly because colon cancer is a completely preventable cancer. In this day and age, we shouldn't have people dying from colon cancer. But anyway, if you were curious, those are some of the cancers. Now, one other thing that I want you to notice about this list, number 10, for the first time, we have suicide as a leading cause of death. So what is this telling you? That as our physical health deteriorates, so does our mental health. And I don't think that you could have seen any better example of this than last year during COVID. What happened to all of us? Well, we started eating more. We started drinking more. We were all stressed. We were losing the ability to cope with day-to-day stresses. And we'll talk about it a little bit more, but you really can't separate physical health from mental health. They go hand in hand. But I think this goes to show you that as our society continues to just move faster and faster, mental health is actually becoming a significant issue that we really need to start paying more attention to. Okay, so what are the leading causes last year? At the beginning of last year, the numbers were looking like COVID was going to be the number 1 killer. To give you an example, in the month of March of last year, we had 3,200 deaths a week of COVID. Normally, we usually have 2,300 deaths a week for heart disease and 2,000 deaths a week for cancer. But COVID was really surpassing that. However, as the year progressed and we came up with vaccinations and how to treat people better, the death rate from COVID declined. So the final numbers are in, and what happened is history repeating itself. Infection got a bit higher on the list, but what's the difference between this list and the 1900s infectious diseases list? While it took us almost 3 decades to come up with a flu shot, it took us less than a year to come up with the COVID vaccine, which is absolutely incredible. And the good thing too is that we have improved surveillance techniques. So, back in 1940 when people were dying from diphtheria, we didn't have ways of communicating with other vicinities, with other communities, with other states. Now we do. We have better ways of monitoring infection, better ways of detecting. So even though infection last year did become a higher thing on the list, fortunately where we are with technology lets us really be able to fight that in a better way. Okay, so you say, okay, Janet, so heart disease and cancer, top 2 killers in this country. Well, what's causing heart disease? Why are we still having cancer as a leading cause? So this is where you really need to do what I call looking at what is the actual cause of death. And can you all see, I feel like I may be blocking your view, but if you can see this chart, What are the two leading actual causes of death in this country? Number one, smoking. Smoking. I remember when I was practicing, I would tell my patients, oh, you need to quit smoking. Oh, gee, doc, if I'm going to die of something, let it be lung cancer. And you know what my response would be? Well, that's if you live long enough to get lung cancer, because before that, it might increase your risk of having a heart attack. Whenever you smoke, it creates inflammation in your arteries. And I don't mean just the arteries in your heart. It's arteries everywhere. So not only does it increase your risk for heart disease, but when it starts to inflame and block the arteries in your brain, you get strokes. In your kidneys, you can get kidney failure. Smoking actually increases your risk of developing diabetes. A lot of my patients never knew that. And lung cancer is not the only kind of cancer that smoking increases your risk of. In fact, smoking increases your risk of all head and neck cancers, of colon cancer, esophageal cancer, liver cancer. And I didn't say this to y'all, but liver cancer is now the fourth most common cancer that causes deaths in men and women in this country. Smoking is a huge contributor to disease in our state and in our country. And what's number two on the list? Being overweight, being obese. And we'll talk a little bit more about the impact of obesity on our health. If you look at Americans today, 6 out of every 10 Americans have at least one of those chronic illnesses that I showed you on that list. They either have emphysema, or they have Alzheimer's, or high blood pressure, or heart disease. 4 out of 10 Americans have 2 of those chronic conditions. And my husband was talking about what percentage of the Texas state budget is spent on health care. It blows my mind that almost 1/3, actually it's a little over 1/3 of our federal budget is spent on health care costs. It's absolutely crazy. If you take this chart, plot 1900, plot it to where we are now and a couple more years, you see the exponential rise in the cost of health care. It's out of control, out of control. It's outpacing everything else. If you look at this chart, that little bottom light blue line, that's the overall rate of inflation. And the line just above it, the darker line, it's typically the average earnings. Healthcare costs are way over that. We are paying more money of our paychecks every day on insurance premiums, on deductibles. We cannot continue to do this. The CDC published a great study back in 2016 where they looked at what were the additional healthcare costs of people that had certain conditions. So what they did is they divided people, they did a survey of about 58,000 people all over the country, face-to-face interviews, and they asked people if they were physically active, somewhat active, or completely inactive. Active folks are those that exercise about 150 minutes per week, which is probably a little bit over 20 minutes a day for 7 days a week. Not much, 20 minutes, that's not that bad. The somewhat active people are people that fell in the category where they were exercising about 0 to 150 minutes per week. And of course, inactive people weren't. And if you see here, those people that were physically active usually spent about $4,500 a year in healthcare expenses. The somewhat active people spent a little bit more, but the physically inactive people spent about $1,300 more a year in healthcare expenses. So keep this chart in mind, and now let's add some other conditions. So let's say you're a smoker and you're physically inactive. Well, the previous slide already showed you that if you were inactive, you're already spending $1,300 more a year on healthcare expenses. But now if you're a smoker, you're going to spend an additional extra $2,000. So if you're a smoker and you're inactive, you spend almost $3,500 a year more in healthcare expenses than someone who doesn't smoke and who is physically active. And you can see the other graphs as well. So the bottom line is, the more health conditions you have or problems, if you're physically inactive, if you smoke, the sicker you are, the more health problems you have, the more you spend on healthcare expenses. So the first thing we have to do is we've got to get people off of cigarettes. Stopping cigarette smoking is probably one of the single most preventable things that we can do to prevent disease and death in this country. That has to be a priority. It still amazes me how many places you go where people still smoke so much. Now you go to Europe and you really see it even more so. But still here in the United States, with all the TV marketing campaigns that are going on, it really still surprises me how many people do smoke. So let's talk about obesity. It's an epidemic. There is no doubt about it. Everybody's worried about pandemics like COVID. We need to worry about the obesity epidemic because before long it's going to be a global pandemic. It is a huge problem. Obesity is defined as somebody whose body mass index is over 30. Now, I don't know how I even got to medical school because I hated math, and I hate to put little formulas in here, but if you wanted to figure out your BMI, you just simply divide your weight in kilograms over your height squared. If you don't want to do math, like I've never liked to do math, you can just Google BMI, put your data, and boom, it gives you your BMI. But anyway, so obesity is considered to be over 30. So what I'm going to do is I'm going to show you a series of slides that shows what has happened to our population in this country in terms of our weight. So this is a huge study that was conducted by a portion of the CDC. And what I'm going to show you is, if you see the map of the United States, that big spot in the middle, that black spot, those are states that we didn't have a lot of data about people's weight in those states. So when when the CDC decided to start looking at, hey, what's happening to our population, what's happening to the weight, they started out with a lot of states that they didn't have a lot of data. I don't know if you can tell the little bar graph on the bottom, but the states are in light blue. Those states at that time had at least 10% of their population in that state meeting criteria for obesity. The darker blue, those states had 10 to 14% of their population meeting criteria for obesity. Obesity, remember, being a BMI of over 30. And I'm going to go through these slides real quickly. So what I want you to do is I want you to get the visual of how these states are getting darker and darker as I go with every year. So this is 85, 86, 87. One of the things that you are noticing is that by 1990, we had a lot of information of almost every state. Still a few states that we didn't have a lot of data, but what you also need to be noticing is that the states are all getting darker. We started light blue, now they're getting darker. 1991. Now we have states down there like Louisiana, Mississippi. Well, now they have a population of where 15 to 19% of that population is meeting the criteria for obesity. So we're going to scroll through here. By 1994, we have data on every state in the union, and then state in the country. And look what's happening. More and more states, look at Texas, kind of embarrassing. More than 15 to 20% of our population met criteria for obesity. Oops. Yeah, now 1997, we had to add a new color. Yellow means that now that population, that state's population, has more than 20% of their population meeting the criteria for obesity. Oops, the country's getting more yellow. And oops, Mississippi again. Now they have a state where they have more than 25% of the population meeting the criteria for obesity. And what's happening? States getting darker, darker. And now we even have some states where they have more than 30% of their population meeting the criteria for obesity. This is not getting better. It's going from bad to worse. So, do we have an epidemic? Absolutely. Now, the next series of maps that I'm going to show you is the relationship of what we started noticing. The more overweight we have people, the more overweight people get, the more they start developing problems like diabetes. And diabetes is one of those conditions that consumes inordinately large amounts of healthcare dollars every single year. And we're going to just slide through them real quickly, but it's kind of the same sort of visual effect. As the obesity map on the left gets darker, The diabetes map trails behind a little bit, but it's continuing to get darker. So here we go, 95. Oops. Getting darker, darker, darker. Trends are not looking good, are they? This is scary. Absolutely scary. And then we wonder why we're spending so much money on healthcare these days. So obesity is a huge problem. We need to deal with it. We need to be aggressive with it because not only does it affect how we feel and the quality of our life, but it's affecting the finances. So how does this all fall in with Texas Tech? Well, like my husband explained to y'all, in the fall of 2019,
We got chastised.
yeah, my husband said, ERS came to visit me, and we got a big F on our health report card. And so my husband said to me, well, you know, you were the medical director of nutrition at the Cooper Clinic. This is what you live, eat, and breathe. You've got to help me fix this problem. I'm like, yeah, right. You had a whole staff to help you fix that problem. No, but so we started talking to the ERS folks. That's when I met Lacey Wolf. And Lacey has a very interesting background. She has a master's in exercise science and health promotion. And she spent, 12 years in Germany and Italy helping our military troops get to know what their wellness benefits were. And when I was telling my husband how you had spent 12 years in Germany and Italy helping the troops, he goes, yeah, well, you know what she was also doing over there in Germany and Italy. Yeah, she was having a good time. But nonetheless, in 2014, Lacey came back to Texas where you were born and raised, is that correct? And so now she's been with ERS, and she has more than 200 state agencies where her job is to help each of those state agencies learn what their health and wellness benefits are. She is what I consider the health and wellness guru. I love following her websites, all the postings that she has. It's really incredible. And Lacey's going to come up here in just a little bit and tell you, as your state agency, what health and benefits you have that you may have no idea. One of the things that Lacey and I talked about is some of the benefits that we have, that we can give our employees free of charge. And this is what blows my mind. I had no idea myself that I had these benefits free of charge through our insurance company, through ERS. And one of those programs that I discovered was a program called Naturally Slim. And this company is a company it's a digital online company that at a minimum will spend 10 weeks with each individual person changing their behavioral habits with food. This is a company that has realized that the obesity epidemic is something that we need to be aggressive with and that we need to deal with. Obviously, I've showed you throughout the years, we're not getting better, so we're not doing something right. So all those fad diets that people talk about, they must not be working because things are not getting any better. So they said, okay, we really need to dive into what is the root of the problem. And one of the interesting things is that one of their co-founder and their chief medical officer was one of the researchers that we used to work with at the Cooper Clinic Institute, which did a lot of research, and he did a lot of research on the effects of weight and diet on health and wellness. So when I learned that he was involved with this company, it really piqued my interest. And like I said, what I love about this company is that they really try to get at the root of the problem of why is it that we haven't been able to deal with this obesity problem. And we'll talk a little bit more about this company, Naturally Slim, in just a little, but I just kind of want to show you our report card. So this was for the fiscal year of 2018, and this was for Texas Tech University. We're probably in a group of 16 largest state agencies. And we came in 15 out of 16. No wonder Porter Wilson came to talk to my husband, because as a state agency, we're consuming a lot of those state funds in our healthcare expenses. And if you look to see, okay, well, why are we having issues? You look at these are the different activities that they use to rank our employees. Number one, health assessment on the bottom and weight loss programs. We didn't have people, we had less than 1% of our employee population using weight loss programs. And we had a very small percentage of our employees that even took health assessments, that saw a provider, or learned about what their risks, their personal risks for disease were. For the fiscal year ending in 2019, our report card really didn't get any better. We were ranking 15 out of 16. Not something to write home about or be proud of. This is our report card for the university, for our health science center in Lubbock. Well, they did a little better, but still not that much better. They ranked 14 out of 16. And for the fiscal year of 2019, still 14 out of 16. So again, back to that Naturally Slim company. What I love about them is that they get to the root of the problem of obesity. Why do we eat? Well, we eat because we're stressed or we're emotional eaters. We eat because we don't sleep well. And I remember when I was doing my residency at UTMB, I remember after being on call all night and being up one day all night and the next day, that I'd be so starving and hungry the next day, and I never understood it. Well, now we know that when we don't sleep well, the next morning we have elevated levels of a hormone called leptin. And what does leptin do? It increases your appetite. So you don't sleep well, guess what? You're hungry the next day.
Lizards.
There you go. But if you sleep better, then those hormone levels go down and you're better able to control your appetite. One of the things too that that I really like about this company is that they realize that the physical health and mental health cannot be separated. They cannot be treated in separate silos. If you have poor physical health, it's going to translate into bad mental health and mental well-being. And if your mental health, state of mental well-being isn't good, it's going to have a negative impact on your physical health. So if we're going to address obesity, if we're going to address overeating, we've got to address the mental health component. So we decided that we were going to launch this Naturally Slim program, that this was a free benefit on our health insurance plan, that if we encouraged our employees to start, maybe we could get to that psychology of eating, and maybe we could teach them to change their eating habits so that they could maybe lose a little bit of weight. So our plan was to have this fabulous health fair in the spring of what? Last year. We were going to have vendors and music and giveaways, and we were going to try to really get people to come and listen to the Naturally Slim program and really get involved. And then March hit and COVID hit, and there went our health fair plan. And you know, I remember back at the end of March thinking, oh, by Easter it'll be over. And then I thought, oh no, by summer it'll be over. And by summer I started realizing this ain't gonna be over anytime soon. And then what did I start noticing? Wow, people around me were gaining weight, we were all eating a lot, we were all having these Zoom happy hours, which is crazy. But then we were all stressed. We were having trouble coping with what was going on. And what I realized is that the health of all of our employees at the system was deteriorating in a very accelerated rate just from COVID. And so we decided, you know what, we're not going to wait for that in-person health fair. We're just going to launch it. And I have to be honest with you, I was a little bit leery and a little bit nervous because I thought, how am I going to reach people by sending them an email or a little postcard in the mail? I was very hesitant. But the Naturally Slim folks really encouraged me. They said, Janet, it's better than nothing. If you reach 10 people, it's better than 0 people. Let's do it. So I'm going to show you this really short 2-minute video to introduce the Naturally Slim program to you.
Have you ever wondered why some people seem to eat the foods they love and never appear to have a problem maintaining a healthy weight? They don't always order salads when they go out to a restaurant. In fact, they eat the kind of foods most people really crave, like hamburgers and fries, pizza, or Mexican food. They don't ever count calories, weigh their food, or add up points. We used to believe these people had fast metabolisms or they were somehow genetically blessed, but as it turns out, that's not at all the case. These folks just behave differently around food, and they do it without even thinking about it. Believe it or not, it's not what you eat, but when and how you eat that will help you lose weight and become healthier. That is the essence of the Naturally Slim program. And you are about to learn the simple, easy-to-follow principles that have helped tens of thousands of participants just like you lose weight and measurably improve their health and quality of life. Even if you have tried everything, we encourage you to forget searching for the next fad diet and experience a program unlike any other, a program grounded in the latest behavioral science that can and will literally change your life. You may be skeptical, but all we ask is that you give us 1 week. Watch all the videos and apply the principles you learn, and you will see how easy it is.
You're going to learn how to eat exactly what it is you want to eat. No diet foods.
This is cool. There's no food to buy. There's no supplements. There's no crazy exercise regimen.
But 26 pounds later, feel real good, and quite honestly, didn't feel like it was anything difficult to do.
So it was amazing, the transformation. I knew that I would be healthier, but I had no idea about the improved quality of life that I would get.
I see this as a program that will be part of my life forever. It's just that easy.
You're going to lose weight on Naturally Slim. That's just what happens. More importantly, though, you'll also learn to keep that weight off. And in the process, you'll dramatically improve both your health and your quality of life. We can't wait to help you get started.
So that's the whole thing. It changes your relationship with food. We've already learned throughout the years that being on diets is not really helping the population of this country lose weight. You have to change how you see food, how you eat. You have to be more mindful. And that's actually why they named this company Naturally Slim. It was trying to research the behavioral patterns of, in quote, naturally slim people. And so we decided that we would launch this program online. So September 1st, it went online. And I have results to present to you of Texas Tech, what happened to us. And these results are as of April 23rd, so just very current, as of last Friday. We sent out emails, we sent out postcards. 585 of the Texas Tech University employees accepted it, meaning they signed up for Naturally Slim. About 76% of those people started the program. What does that mean? That out of the 10-week course, they did the first week. They did the first session. Now, let me tell you, it's not like it's a big thing. You can do it on your cell phone. You can do it on your laptop. You can do it while you're working out. You can do it anywhere. You decide when you do it. And the little videos are 5 to 10, the longest maybe 13 minutes. And they're basically teaching you how to think of food. So out of those 76 people that started, that did the first week, about 66% of those employees who started actually did 2 sessions or more. Here's a little bit of the demographics of the Texas Tech University employees that started. We had more women than men, sort of late 40s age group. And if you look at both of men and women, they did meet criteria on the average for obesity. They had a BMI of over 30. When you look further into the characteristics of the folks that joined our Naturally Slim program, you find that a lot of them did have conditions related to being overweight. They had high blood pressure, they had sleep apnea, they had problems with joint pain, knee pain, ankle pain, low back pain. So they did have risk factors that were brought on because of their weight. So here are some of the results that we've had as of April 23rd. And a couple of things that I want you to notice. If you look at the session from 2 sessions to 10 sessions, what is the thing that we learned? The more sessions each person is involved in, the more successful weight loss they have. So, you attended 3 sessions, yeah, you lose weight, but if you attend 10 sessions, you lose even more weight. Both groups, men and women, lost weight. Now you might ask yourself, yeah, but what happens after 10 weeks? Well, after 10 weeks, you have another 10 more weeks. And those 10 weeks are more geared individually to each person's needs. And that's where a lot of the mental health component comes into it. And then after those 10 weeks, if you do real well after that, you get another 34 weeks. So you can actually stay on this program for a full year so that you're constantly learning and ingraining in yourself the new behavior that you need to adopt. Because obviously we've got to change our behaviors if we're going to make this work. Federal guidelines suggest that if you lose even 3% of your body weight, you get health benefits. And of 61% of our employees who started the program, at least 61% of them lost 3.6% of their body weight. So it's been successful for our employees. Now, yeah, you get health benefits if you lose 3% of your body weight. If you lose more, you get even more benefits. It's kind of like what I always used to tell my patients about exercise. If you want just to improve your health, your cardiovascular fitness, you just need to exercise about 3 days a week. But if you want to lose weight and have other benefits, more is always better. So if you look at the bar graph on the bottom, you see exactly that. We had a majority of our employees that lost weight, and they were able to prevent things like diabetes. They had improvements in their cholesterol. But the more weight they lost, they had improvements with their blood pressure, with their joints, with acid reflux, sleep apnea, all sorts of things. So, last year, we got a wellness report card, and we went from 15 out of 16 to 5 out of 16. And that's only in 4 months of launching the program. 4 months of people being more mindful of how they were eating. So what about our Health Science Center? The Texas Tech University Health Science Center, which is located in Lubbock. We had 869 individuals accept our invitation. 68% started, meaning they did week 1, but 66% of them actually did 2 sessions or more. The demographics, again, more men than women. Age group, a little bit higher 40s, 50. Our population of employees at the Health Science Center probably a little bit more overweight than our Texas Tech University employees. Their BMIs did meet criteria for obesity, but a little higher than the average for Texas Tech. And again, these folks, again, had a lot of the same complications from their weight. They had high blood pressure, there was some gestational diabetes, sleep apnea, back pain, all sorts of problems related to their weight. And so what happened, again, the more sessions that our HSC, that our Health Science Center employees partook in, the more weight they lost. And again, as a reminder, just losing 3% of your body weight gives you health benefits. And if you see, we had, of the participants that joined from the Health Science Center, who just were overweight, 68% lost 3% of their body fat. 39% of people with high blood pressure, they lost 3% of their body fat, and so on and so forth. So we have had success in just 4 months of this program with our employees. And again, the more weight loss you do, the more benefits you get. And again, we're dropping the incidence of sleep apnea, reflux, joint problems, back pain, diabetes, everything with the weight loss. So I was pretty excited about these results, but I always think that we can make something that's good better. And so I was looking at our report card from last year, and I was trying to figure out, okay, so we've got people and looking at their overall mindfulness and eating. How can I make it better? Oh, and I'm sorry, and the Health Science Center moved up from 14 out of 16 to 9 out of 16. So in trying to figure out how I can make it better, I noticed that our health report card said that part of the problem that we still had is that our employees were not involved in assessments, meaning that they weren't going to see a doctor or take any kind of survey so that they could learn about what were they at risk for, and were they at risk? Did they know what their blood pressure was? Did they know what their BMI was? Did they know what their risks were? And what we also noticed during that COVID year is that people weren't going to the doctor. We know that if they had symptoms, they were afraid to leave their house. The doctor probably wouldn't see, their doctor's office was closed. And even though we started having telehealth emerge more in Texas than we've ever had it, our employees were not taking advantage of it. Same thing for the Health Science Center. What I realized is that, even though our employees were now more involved in weight loss programs, again, they weren't doing visits with healthcare providers, with physicians. They weren't taking health assessments. So what we decided to do to try to make improvements in those areas is that in January of this year, we launched what we call a virtual checkup. And this is the coolest thing ever. Because if you sign up for these virtual checkups, again, free benefit for our state agency with our benefits, you get this little box in the mail. And the box has a digital blood pressure cuff that you can check your blood pressure with and you get to keep, which is really neat. I think everybody should always monitor their blood pressure. You get a little measuring tape so that you can measure the circumference of your abdomen, even if you may not always want to do that. And then you get this little disc. And in that disc, it gives you like a little injector where you can stick your finger. And if you put about 3 or 4 drops of blood in this disc and ship it into the lab, it will tell you what your fasting blood sugar is and what your cholesterol numbers are so that we can predict what your risk for heart disease is. So basically, you get this kit in the mail, you check your blood pressure, you write it down, you check your abdominal girth, write it down, you do your blood test, and send it all in. When the lab results are ready, they get sent to a healthcare provider, typically a nurse practitioner, who will send you a little email, hey, got your results, let's get together and let's discuss them. So then you set up your appointment, and as you're getting ready to visit with your healthcare provider, there's another questionnaire with some other questions about your life, your health, your symptoms. And there's a couple of questions there that have validity in the medical literature in terms of trying to screen for problems like stress, depression, and anxiety. And so then you have this visit with this provider that says, hey, these are the results. This is your blood sugar. This is what your risk for diabetes is or isn't. This is what your risk for heart disease is or isn't. We figured out what your BMI is, and you know what? We need to make changes. And so this visit with this health provider educates people as to what the risks are, or if you don't have risk, hey, great encouragement, you're doing the right thing. And it makes sure that it gives all these results to your own primary care physician, and if you don't have a primary care physician, they will hook you up with somebody on your insurance plan. And so we've launched this program as of January 1st of this year, and as of last week, we actually have 379 people who've actually registered for the process and 247 people that have completed their evaluation, meaning not only did they send in all their results, but now they've had their visit with the nurse practitioner and have been told where they stand. And so we're hoping to continue to get people involved, get their health assessments, change their dietary habits. And what we're trying to do is improve the health of all of our employees, not only so that they feel better, both physically and emotionally, but it helps them to be more productive, and we actively help to reduce not only the healthcare costs of the university, but their own personal healthcare costs. They're not paying so much money for their insurance premiums, or they're not paying as much on deductibles. So to conclude, so that y'all don't get too bored with me, if I were to write you a prescription for what you need to do to have good health, good quality of life, the same prescription that I would give to everybody in this room, to all of our employees and staff at the system, the first thing would be, you gotta keep your weight down, and you have to follow a healthy diet. Number 2, you can't do it without exercise. But you know what? I've gotten to the point that I hate to talk to people about the word exercise. Nowadays, it has such a negative connotation that I'm almost afraid to even say it. So I say movement. I say movement is medicine. Movement is what you need to do. Any kind of movement is good. 10 minutes of movement is better than nothing. 10 minutes of movement every day eventually leads you to add up more and more. So you've got to move, you've got to move. No doubt about it, I think I showed you that quitting smoking is probably the single most thing that we can do to prevent disease and death in this country. Limit alcoholic beverages. I always say they're an empty source of calories. There is absolutely no nutritional value in alcohol. Not only does it contribute to calories, but it increases your risk for strokes, for high blood pressure. It increases your risk for many types of cancer. And of course, moderation is the key to everything. Just like we have to moderate what we eat, we have to moderate what we drink. Stress management, absolutely critical. More and more we're learning that we cannot separate the mental health component from the physical health component, and we've got to address it. And last but not least, what Dr. Cooper always said, preventive evaluations. We've got to teach people what their risks are so that we can empower them to take better care of themselves. And vaccinations, that's always part of the physical. And if you can't get into your doctor, then do it through telehealth. Because our state legislature realizes the importance of telehealth, and it's making it easier and easier for all of us to access. So with that, I'm going to conclude my presentation, but I do want to mention something to y'all. Be sure to pick up your gift bags before you leave. So what we have in the gift bags, we wanted to share a little bit of each of one of the universities in our system. We have 4 universities, Angelo State. We have our Health Science Center in El Paso, our Health Science Center in Lubbock, and of course, the flagship university, Texas Tech University. We have a little something for you from each university, but Naturally Slim has given me the opportunity to gift each one of you their starter kit free of charge. So if you want to sign up for their program, we have the kit. All you have to do is sign up. And that virtual checkup, that checkup in the box that I told you all about, we are also giving you an opportunity to partake in that free of charge. So you can all get your virtual checkup. You can all see what your risks for disease are and how to start changing them. And I hope that you take full advantage of this. And just as I was completely unaware of some of our wellness benefits on our insurance plan, I'm willing to bet that some of you here are probably unsure about what your own wellness insurance benefits are. And that's where Lacey is going to come up and tell you a little bit specifically about your group and what some of your health and wellness benefits are.
Thank you.
And then we can take questions. If y'all want to stick on us, we're happy to take questions.
Okay, thank you so much for having me. It's really an honor to be here, and I just wanted to hit, is it okay to call you all the doctors, Mitchell? Is that appropriate?
Janet's fine.
So they also participated in the programs, which, that's leadership, in my opinion. They went through the virtual checkups, they participated and went through the Naturally Slim program. So it's really cool that they have not only, they're not only advocating for these programs, but they understand them. So please take advantage of Janet's gift and do the virtual checkup, do the Naturally Slim program so that you can talk about it to other people, because you all have influence probably way beyond even what you are aware of in this room. So I grew up on a farm. I just wanted to tell you a little bit about my background. I grew up on a farm in West Texas, and my dad, at the age of 62, had a stroke. He was a farmer his whole life, and in 2008, he could not afford health care. He could not afford insurance. And so he went to work for the state. He worked for TDCJ for 10 years and retired with full medical benefits. I believe those medical benefits are why he's still alive today. So I'm very passionate about what I do, and I think these benefits mean a whole lot to a lot of people. And they're a reason why a lot of people do really hard jobs for the state of Texas. So how many of you are using ERS health plan? Awesome, great. So most of you are also participants in our health plan. How many of you knew about Naturally Slim before hearing Janet's talk today? Raise your hand if you knew about it. You heard about it. Had you heard about it, or did you know,
I've heard about it.
You heard about it, okay. So not many people know about these programs, and the reason I think it's so difficult to get people awareness about these programs is because we've got 200 different entities. It's very much like it's an archipelago. I work with every agency, every higher education institution speaks its own language, has its own environment, has its own culture. And so the key, if we had a Janet at every university and every agency, I believe we could really impact the state of Texas and our health. But we don't have these advocates everywhere. advocating for them, with whoever you have influence with is awesome. So we've got Naturally Slim, which is an amazing program that is 100% backed by science. I saw some research the other day that showed that people that participated in Naturally Slim, you just saw the data. During the pandemic, most people gained, according to the APA, 26 pounds. During the pandemic, people have just gotten stressed out, eating, drinking. There's all kinds of negative things that are happening because of the pandemic. But weight gain is one of them. And it's a manifestation of other things, with our mental health as well. So people who participated, and there's like 65,000 people in Naturally Slim lost weight during the pandemic. That's amazing. And then we've got Real Appeal, which is another weight management program that's available through the Rally Health. We brought that one over from United Healthcare. It's a 52-week program that's built on small changes. Both of these are certified diabetes prevention programs, which is, if you understand the diabetes prevention programs, they are backed by a lot of research, and so they work. So Naturally Slim, Real Appeal. We have Well on Target, which is a wellness portal that's available through our health plan where you can take an online health assessment. It will give you a snapshot of your health. Through that, you can earn blue points where you can buy actual things in a store. I bought a Cuisinart pressure cooker during the pandemic that I use all the time I try to buy wellness things with my wellness points. But it's a little external incentive to do things that will help you improve your health. And then another thing that ERS is doing that I wanted to just make everybody aware of is that we have access to virtual mental health visits at no cost to plan participants right now. And that has been throughout the entire year. Did anybody know about that? Okay, so mental health, we talk about, it's a massive problem right now. You saw suicide made its way onto that list, and that's the absolute worst thing, that could happen to a person, is to get so far down into the depths of depression that they take their life. We are working toward improving mental health resources. We just doubled our network by moving our mental health in-house. We don't use Magellan anymore. Now we have Blue Cross Blue Shield managing all of our mental health benefits. So I just wanted to make y'all aware of that because I think it's one of those things that we need to know about it before you need it. Because when you're really in the depths of depression or anxiety, you don't have the capacity sometimes to make that phone call or to get the app. So get the app, know where to go in case you ever need it or someone in your family ever needs those resources. So I'm here to talk to y'all. If you have any questions about any of the wellness benefits, please let me know. And I have my cards, and happy to stick around. And so thank you so much.
And actually, stay up here with me, Lacey, in case they have any questions for you. But like I said, she's sort of my health and wellness guru at ERS, and she was making me aware of some of these health online assessments. And that's the next step that we're doing. I called my husband and I said, listen, what if our employees take a health assessment online? Are you willing to give them a day off of work, a wellness day off of work because they took that Healthline assessment? He said, sure, we'll do it. So we're actually in the process of implementing that as well. So there's so many benefits, like Lacey said.
That's one of those rhetorical questions. Yeah.
Where do you want to sleep tonight?
Are you willing to do this? Let me think.
I think they're going to make it to number one on their report card because apparently data really motivates Janet.
So let me ask this. Who is expecting this kind of talk from Texas Tech? Anybody?
Yes.
Who? There you go.
I've heard about her.
So.
And by the way, her niece makes a little product that's in all of your gift bags today, too.
So let's give these two another round of applause.
Does anybody have any questions, thoughts, anything?
Good job.
Thank you. Thank you, Karen. Anything else?
Carrie.
I'll ask a question. When we're talking about the diseases, what role does heredity, your genes, play in?
Great question. Heredity can play a huge role, especially in things like heart disease, Alzheimer's, diabetes, high blood pressure, and everything. But on top of hereditary, add our extra risks, and it just exponentially grows higher. So if you do have a family history for all those conditions, your risk is even higher. But that doesn't mean you can't do anything about it. You can actually lower it.
And one of the things we used to talk about at Cooper all the time, your genetics might load the gun, but very often it's your behaviors that pull the trigger.
Mm-hmm. So, good
You
question.
hear about it a lot.
A lot.
You are destined. This is the way it's going to be.
No, you're not necessarily destined. We live in a day and age where we can actually intervene, which is the whole point of doing a checkup, of doing a health assessment. Hey, you've got that risk. Your dad had a heart attack at 40. Your uncle had a heart attack at 42. You're how old? You're 40? Ooh, we need to do something about this. You can change things. You can. Ignorance is not bliss.
I'm a teacher, and we talked about the risks of smoking, but in today's world, it's like, well, I'm not smoking, I'm vaping. And is that along the same lines with the risks that we need to be talking about?
Absolutely it is. On different levels. Number one, vaping, I think we've seen the data that it also produces this lung condition, this inflammation from the oils. So vaping itself has its own personal risks. But if you're inhaling the nicotine, and you're still getting a lot of the negative effects from nicotine. Nicotine will constrict blood vessels. It can increase your risk for heart attacks. It can increase your risk for strokes. So a lot of the health risks that we see from inhaling a nicotine in a cigarette are still there. So yeah, it's a good question. We've got to teach our kids.
The
that it
tiny
continues to be a
little
risk.
sacs in your lungs are not meant to be filled with oil.
Nicotine gum, too.
Well,
Right.
nicotine gum is meant to be a tool to get you off of cigarettes. Because, I used to tell my patients that smoking and being addicted to cigarettes is almost as tough as being addicted to heroin. It's truly a very difficult addiction to beat. But if you can use either Nicorette gum, lollipops, patches, to help lower your blood levels of nicotine on a very slow, steady pace, and if it can get you off of cigarettes, yeah, I would absolutely recommend using them. But you're supposed to get off of them. They're not meant to be something long-term. It's a tool to get you off. Unfortunately, some people just continue to use them. But no, you've got to get off of them.
How do we get your app, Lacey, or whatever it is, to follow?
So I can give you my website. It's ers.texas.gov/wellness, or I'll give you a card before you leave here. But each week I do webinars every week where I feature speakers on different wellness topics. I just launched a podcast where actually Janet is one of my podcast guests, where it's called Walk and Talk, where we're going to go for a 20 to 30 minute walk and talk with someone. The idea is you go out for a walk while you listen to it. And so we're really doing things at ERS to try to build a community. So thank you for asking, and I'll be happy to share, to get involved with some of the things that we're doing. Each month we have a different toolkit theme. Last month we focused on stress awareness. May is mental health awareness. So I've got speakers that are going to be talking about the mental health benefits, anxiety, and just helping people to understand what can we do to help destigmatize mental health. June is Great Outdoors Month. I've got Rodney Franklin from Texas Parks, our Parks Director, is with me. So every month it's engaging and interesting topics.
Lacey, is it okay to get your website to everybody, the
Absolutely.
link?
Yeah, and this is what I was going to say about the ERS website. The ERS website is actually very friendly to navigate. It really amazed me how friendly it is. You can go to just ers.gov, I think, isn't it?
Yes, and then do the /wellness to get to my page specific.
Yeah, and if you don't do that, right from the top menu, you can see wellness, and it will take you right to all the different wellness activities that Lacey posts. I mean, she has featured speakers, she has it's a great thing to take advantage of.
And a statement that I've been amazed at through the years, obviously in my 20 years old, smoking stays with you forever. I thought in 10 years it would ask me, 30 or 40 years, and you know better than I, but apparently.
Long-term effects from smoking.
Yeah.
Yes.
And
Now,
if you've done it, you've done it. But the young people, I think.
Now, even though the long-term effects stay with you, here's the good news. Because you might say, well, then why should I quit smoking? The good news is that we do have a lot of data to suggest that the further out you are from quitting smoking, you do get benefits, especially for heart disease and lung disease. So yeah, you kind of, if you smoke, it's going to affect you, but you can actually change that and you can get better.
But they keep that, those are real.
So,
I didn't graduate from Texas Tech, but at Sam Houston, I graduated as what I call a PE teacher. So for 29 years, we've talked about this, but I see the repetition, the circle go around with education. And back then, 72, when I graduated, the big deal was PE every day, and aerobics was the big thing back then. But we've gotten away from that. I see my grandchildren in elementary school maybe get it 2 times, 3 times a week at the most. And Phil and I both believe education is the basis for our whole world. So I think that's a big area, not just for our age group, but for our kids. They're being educated.
Sue, you made a fabulous point, because you know why we don't have PE in grade school education? Money. Money. And that's a shame, because if we actually spent that money to put PE back in classes and back in school, we would see our healthcare dollars drop immediately. And so you are in a perfect place. I mean, I think you know some people that might help us get PE back.
I talk.
I wanted to just add, thinking about the data specifically, you talked about national data. At ERS, I was in a meeting last week. We spent $484 million on diabetes just in healthcare costs, not including pharma, last year in 2020. And $484 million, so $9,000-ish per patient with diabetes, compared to about $4,000 for patients without diabetes. 12% of our ERS adult population has type 2 diabetes. So we're higher than the national average when you saw the statistics up here. And I think we all play a part, like you said, starting with our kids, right? But the money is one thing, but you think about like how those are hospital visits, those are amputations, these are people's lives that are being affected. So definitely we got to start young. And I just wanted to throw in a little of our data too.
Actually, COVID loves sugar. So therefore, if people were educated, just like what you said, and careful with the sugar, that would be helpful.
And think about the risks for COVID. What's one of the top ones they talk about all the time? Diabetes and obesity.
Right.
If you get COVID and you have either of those, your chances of having real problems are much higher than somebody with COVID that doesn't have those.
True, but that's not discussed. Yes.
Right.
The education that we're discussing is so
Absolutely.
for everyone.
So that COVID number 3, did they happen to break that out for pre-existing conditions and then they got COVID?
No, it's just COVID deaths total.
Total. No matter what, if you had COVID, they said you got COVID.
Right. Well, I can't thank y'all enough for coming. Like I said, I'm just so excited to even have an in-person event. We're getting healthier, we're getting vaccinated. Thank you all for coming. Don't forget your gift bags. I do want to say something about the Naturally Slim gift box that you have too. They are actually rebranding. And as of June, they're going to be called Wonder Health. And I'm not even going to get into how they did the name change. But the reason they're changing is because through this COVID year, they have realized how much more even important the mental health component is. And they wanted a name that was more inclusive of everything they do. And they do a lot with regards to emotional health and mental health. And so if you do that and then all of a sudden see that it's Wonder Health, just be alerted. They're rebranding as of June, but it's the same program, the same science-backed medicine and everything. So thank you again, and hope to see you again.